Okay, good morning everyone. So we're going to begin our presentation here for diabetes, talking about diabetes and your feet. I'm Dr. Bruce Pinker. I'm a foot surgeon and podiatrist located in White Plains here in Westchester for many years. And I'm proud to make this presentation to you. This is my 8th year giving this special presentation to educate and inform you about taking better care about your feet, especially if you are a diabetic. So without further ado, let's begin our presentation. It's diabetes is a family affair. We're going to talk about your feet, diabetes and your feet, the winning combination that you need to know. So you may say, what is diabetes? Not everybody knows. It's a very popular disease. Lots of people have it. So diabetes is a disease that occurs when the pancreas in your body does not produce enough insulin, or when the body cannot effectively use the insulin that it's producing, and it causes us to improperly use the sugar that's in our bodies. So there are some fast facts you need to know about diabetes. Did you know that over 29 million people in the U.S. have diabetes? And it's the 7th leading cause of death in our country. 25% of the diabetic population will develop a foot ulcer. We're going to talk a little more about ulcers. It has to do with wounds on the foot, typically around the big toe or the little toe or even the heel. And we'll go into more detail about that in a few minutes. It's important to understand that. Also, every 10 hours, Americans undergo amputations due to diabetes. That's every 10 hours. That's about twice a day. So these are startling statistics that we need to understand because this disease has major effects and impacts on our community, especially the African American community. About 3.2 million African Americans, it's about 13%, over the age of 20 have diabetes. 25% of African Americans from 65 to 74 years of age are affected, and it's the 4th leading cause of death among the African American community. Also, did you know that 1 in 4 African American women over the age of 55 has the disease? So it has a major impact on the African American community and also on other communities as well, other ethnicities as well. So there are different types of diabetes, as you might know. There's type 1, and typically people with type 1 are thin, and they take insulin, and that rhymes, so that's an easy way to remember that. Typically they get it when they're younger, but older people can also have diabetes. You can get it when you're an adult, but many people are born with type 1 diabetes. They tend to be very thin, and they need to take insulin. Then there's type 2 diabetes, much, much more common. And we see this more in adults. When they get to age 40 and above, they can develop diabetes. They tend to be older, about 40 years of age or more, and they tend to be overweight. These are very common characteristics of type 2 diabetics. And we'll talk more about them too. And then there's gestational diabetes, where a woman can develop diabetes when she's pregnant. Blood sugar goes up, the body's under a lot of stress during the pregnancy, and they will usually resolve the diabetes. It will go away after pregnancy is over. Okay? So there are actually quite a few celebrities that have diabetes. Those that have type 1 diabetes: Halle Berry, Mary Tyler Moore, Bret Michaels, who's a rock and roll star. He was actually the winner of the Celebrity Apprentice show. You might know who he is. Nick Jonas, also another musician. Jay Cutler, professional athlete, football player. Type 2 diabetics, type 2, much more common. We find this more commonly in our communities, in our population. Tom Hanks has type 2 diabetes. Paula Deen, Paul Sorvino, Randy Jackson from American Idol. Billie Jean King, Patti LaBelle, Larry King from CNN. So lots of people have type 2 diabetes. And even gestational diabetes, we know Selma Hayek had when she was pregnant. So what are the characteristics of type 1? Well, I just touched on it a minute ago. They're usually insulin dependent. They take insulin. Onset is when they're younger. They're thin. And some type 1 diabetics may actually need to take oral medication, some pills, to help control the blood sugar in addition to the insulin that they take. So who's at risk? Well, type 2 is much backgrounds being African American, American Indian, Alaskan Native, Asian American, Pacific Islanders, Hispanic and Latino Americans as well. Now you may say, well, why is this? Well, it's more common, we believe, because it has to do with their culture. Sometimes the foods that they eat are very high in sugar, lots of fruits, tropical fruits in the areas where a lot of these people may come from. Lots of tropical fruits, high carbohydrate diets can lead to high sugar intake and an overload, leading to diabetes. And there are other reasons as well. Sometimes it has to do with your genetics as well. That's a major impact. Also, if you're overweight or obese, it contributes to diabetes. You have a higher risk of getting diabetes. And if you have a family history of type 2 diabetes, meaning your father had it, your grandmother had it, they pass it along in the genes to you. And if someone had gestational diabetes, whether you were the woman who had gestational diabetes during your pregnancy, or if your mother had gestational diabetes, both of you can be at risk for developing diabetes later on. So, common characteristics of type 2, it's much more common. It's the adult onset, typically, of diabetes, 40 years of age and older. It's more and more common now in children because we find that young people tend to be very inactive. They lead a more sedentary lifestyle. They sit at home, they play on the computer, they play video games. They're not outside playing with their friends like most kids would do or used to do. So that contributes to less activity. They're not using the calories that they take in, and they're becoming overweight or obese. Also, type 2 characteristics, about 90 to 95% of all people with diabetes have the type 2. So again, much, much more common. And we're talking millions of people just in the US. So what we see when there's type 2 diabetes, we do find that these people have frequent infections, even yeast infections. They may have blurry vision because diabetes can affect the microvasculature, I mean the small blood vessels that go to the eyes, can affect vision because of that. It can cause cuts and bruises that are slow to heal, tingling and numbness in the hands and feet, something we call neuropathy, which we'll talk more about shortly. Recurring skin, gum, and bladder infections, and increased urination or increased thirst, all things we see in type 2 diabetics. There could be weight loss, although, as I said, a lot of type 2 diabetics tend to be overweight or obese, but there can be a period where there is some loss of weight. But type 2 diabetics also tend to be hungry. They may have itchy, dry skin, and they may suffer from fatigue or irritability. They may get tired very easily. So what do we see in the foot? I'm the specialist in the foot, and what we see commonly in the foot when you're a diabetic, if you're not taking good care of yourself, we see redness, we see numbness, swelling, coldness to touch, and inflammation. Inflammation is a broad term. There are lots of ways to detect inflammation, to check for it, such as a diagnostic sonogram to check the soft tissue levels in the heel, down here in this part of the foot. If you look on the model, the plantar fascia tends to get inflamed in a lot of people. Also in the joints across the foot, from the big toe to the little toe, high areas of inflammation. So we do see that a lot. And also in the ankle, there can be inflammation as well. A lot of different ways that we check for this in the office. So how do we treat type 2 diabetes? Well, because type 2 diabetes is often brought on by being overweight, it can normally be controlled with a combination of good nutrition, some exercise, and good blood glucose monitoring, meaning check your blood sugar. There's a way to stick with your finger, and there are some other more advanced devices that are even easier to use to just check your blood sugar on your own. And sometimes type 2 diabetics do need to take medication, such as a pill, to control the blood sugar. One of the most common first-line medications a lot of type 2 diabetics start with is glucophage, also known as metformin, and also glipizide. Most commonly started by your primary care doctor or an endocrinologist. Well, it has some major impact. So if your diabetes is not controlled, it can lead to many foot complications. It can lead to the ulcers that I mentioned a few minutes ago. It's a breakdown of the skin on the foot that's difficult to heal and can lead to an infection. Again, the heels, very common areas for ulceration, breakdown of the skin. They develop a wound in some cases, and that wound can get infected and lead to very, very serious complications where you might need IV antibiotics, and sometimes it's a very difficult infection to resolve. But the wounds on the foot that start with an ulcer or break in the skin many times can be prevented in some simple ways by just checking your feet every day, and we'll go into that in just a minute. Another common complication that we find in diabetes is neuropathy. Not everyone gets it, but a lot of people, especially if they're older and their blood sugar is not very well controlled, can develop neuropathy, which is a numbness, a tingling, and a burning in the foot, which diminishes your sensation. We have special tests in the office to check to see if you have neuropathy. There are many patients who will tell us, I have numbness all the time, I have tingling, shooting pains, and there are ways to check for it. So you need to test first so you know the degree of neuropathy. And then there are different options for dealing with neuropathy, such as a supplement like alpha-lipoic acid can benefit you if you have neuropathy in some cases. Sometimes there's medication that's necessary to control that numbness, tingling, burning feeling that you get in the foot, such as Neurontin, Lyric blood sugar from the very beginning. When your blood sugar goes too high, it prevents the nerves from sending impulses from your brain and the spinal cord down to your feet. So when the impulses are not being sent properly, you get those numbness, the burning, the tingling type of feelings. It's usually because sugar is going too high, and that affects the transmission of the nerve impulses. And we know this from a lot of research. Also, amputations, a very common type of complication, the worst possible complication that we could deal with when it comes to diabetes, usually as a result of a wound that developed on the foot that became a serious ulcer, breakdown of the skin, that could not be healed with wound care, with IV antibiotics, with oral antibiotics. Sometimes the very best option for a patient with a very serious infection down in the bone, deep-rooted in the toe or in the midfoot or the heel, is to remove the bone, because sometimes you can't get rid of the infection otherwise. And that's very serious, and we try to avoid that at all costs. But in some cases, we try everything we can, IV antibiotics, oral antibiotics, lots of heavy wound care, even hyperbaric oxygen can work for some patients with serious wounds, diabetic wounds. And we find the only other option to resolve this infection is to take the bone out. And that usually works well, but it's the absolute last option. We do not want to do that unless we absolutely must. So what's the prevalence of the lower limb amputations? Because this is really serious. These are life-changing events for patients. Well, diabetes is the cause of more than 60% of the non-traumatic lower limb amputations in our country. So what we're talking about here, folks, specifically is non-traumatic, meaning it's not from a lawnmower injury, it's not from a car accident. This is because diabetes became so serious in this patient's body that they couldn't heal the ulcers, the wounds, they got infected, and the only other option was to remove part of the bone. So say the big toe had to be removed, for example. The big toe is commonly affected when we talk about wounds and ulcerations and infections in diabetes. So 60% of the non-traumatic, meaning not because of an accident or an injury, 60% are caused by diabetes. But the good news is that these amputation rates can be reduced significantly by 45% to 85% by simply having a comprehensive foot care program, meaning have your feet checked. When you go to your primary care doctor, make sure they do an exam from head to toe, really down to the toes. Take off your shoes and socks and let them take a look at your feet, okay? If you're not a diabetic, this is something you should be doing. And if you are a diabetic, you should be going to see a podiatrist once a year or twice a year, depending upon your risk level. If you're at high risk, you should see the podiatrist quite often to have your feet checked. Low risk, at least once a year, if not twice a year. The simple foot exam can reveal the signs and symptoms of diabetes and identify the more serious complications that could lead to these lower limb amputations. So diabetes is a family affair. it can affect